Wisconsin's Governor Tony Evers has signed an executive order on health equity. This is executive order number 17. He's only been in office a couple months, and already we have 17 executive orders, each one identifying some priorities of this administration. This one is called the creation of a Governor's Health Equity Council. It's recognizing in the executive order Wisconsin's dramatic worsening health disparities score. Wisconsin has overall pretty consistent health outcomes, but when you look at disparities in Wisconsin, they are getting worse. And this is among the categories of geographic disparities, limits on access to care, and economic, social, racial, and other barriers to care. The executive order understands the impact of the social determinants on health and therefore is taking steps to create a council to get parties and leaders together to make sure that we can make some strides and make some gains in these areas. The executive order calls for the executive branch, the lieutenant governor, to sit with a representative of the Department of Health Services, the Department of Children and Families, and members of the community to join this council and discuss these issues. The goal is to develop a plan. They have a plan to meet benchmarks by the year 2030 by which disparities will be reduced. The plan, and this is a quote right out of the executive order, the plan shall address health disparities in populations based on race, economic status, education level, history of incarceration, and geographic location. Now, we said there would be some community members that would be invited to join this panel, and we'll tell you about that in just a second of how to put your name in the ring. Governor Evers made two quotes when he signed this executive order. He said, first, accepting federal funds to expand Medicaid is central to our efforts to improve the health and well-being of Wisconsinites, and we have a separate video talking about some of the health priorities coming out of the Evers budget as in terms of Medicaid expansion. But he goes on to say that this goal of this executive order is just as important. He says, but so too is addressing the racial, socioeconomic, and geographic disparities that contribute to poor health outcomes. He finished his press conference when signing this executive order by saying, we will continue to seek innovative and common sense solutions to improve health outcomes and reduce disparities. There's a real commitment to try something new and make sure we can make some gains to make sure people are healthy in the state of Wisconsin, no matter where they live, no matter how much money they have, and the other factors he's identified. Now, like we said, if you're interested in putting your name in the ring to be considered to join the Health Equity Council, there is an email address and there is a deadline. We share that email address with you in the description below. The deadline is April 30th. You can read the executive order yourself, executive order number 17. You can also read a little bit of the news coverage that has gone along with this executive order. It is getting a lot of attention. It is a very important issue. If you have questions on health equity or health disparities in the state or other questions, just simply send us an email or visit us at healthwatchwisconsin.org.